Hi everybody, welcome to week 5. We have crossed the halfway point of our course. Good job. All right, thanks for the really good discussion last week about EMRs. Charting is a topic that every nurse has strong feelings about, so thanks for that. I'm looking also forward to seeing your group paper. When I looked in the group forum, it seemed like everyone was participating, and so I appreciate your hard work on that, and I'm looking forward to seeing what you came up with. All right, on to week 5. So this week, we do not have the most engaging topics in our discussion questions. So we are discussing focused versus complete assessments, okay? And there are definitely times to use both, just depending on the circumstances, right? So the first discussion question is more about the thought process of when or why you're going to be using a focused versus a complete assessment, and then also the charting. The second discussion question is about comparing the content of those two types of assessments. All right, so let's add another component to this week to kind of round things out. So when teaching health assessment, we need to emphasize the accuracy and level of detail involved with an assessment, right? And I'm going to be posting an article and a class question about health assessment and an art gallery. It's a little bit different, a little bit outside the box. It's an unusual approach, but I think there might be some things that we can take away from this instructor's approach to teaching health assessment. So view it with an open mind and see what you might be able to take from it. All right, now on to our assignment for this week. We are going to use the case study that is attached to the assignment, and we're just going to read down through the ABG results and stop there. Those questions below it, nope, not going to address those, okay? So you are going to use your imagination a little bit for this assignment. So based on the information in the case study and any other details you want to add about the patient, you will need to document a focused history, the results of a physical exam, 3 nursing diagnoses, preferably the priority nursing diagnoses, and a plan of care, otherwise called nursing process, to address those 3 nursing diagnoses, okay? So there's definitely not enough information in that case study attachment to actually complete a history and physical, pulling it out. So you will just supply whatever details you need that are consistent with the case study. Please look at the rubric, though, on the things that you need to include, particularly on the history part, and I think in the case rubric it's called case history, whatever you want to call it, case history, health history, whatever. So you can format this information any way you want, as long as it's all there, okay? There is, though, one item in the rubric that isn't really addressed in the directions. It says, compares the similarities and differences in a focused assessment versus a complete assessment. So what's the same, what's different? This does need to be in a paragraph format. So you'll write a little paragraph about the similarities and differences. And then you will also need to use references. You might want to think about those nursing diagnoses and that plan of care, because a lot of times you need to cite where those things come from. So go ahead with that. Please let me know if you have any questions. You know, you can just send one out in the individual forum or the question to the instructor forum, and I'll get back to you just as soon as I can. So I think that's about it for this week. All right, guys, I'll see you in the main forum.